Welcome back to Pain Diaries. We're going to talk to one of Medtronic's medical experts and my partner at Performance Pain and Sports Medicine, Dr. Matt Wiederholz. Welcome back to the show.
Thanks for having me.
Absolutely. So are you ready to talk all things Medtronic spinal cord stimulation?
I sure am.
So first off, how does it work? What is it? How does it help alleviate chronic pain?
Great question. So spinal cord stimulation is an implant of a device that delivers impulses to the spinal cord to block pain signals. And it basically confuses the brain so that you don't feel the pain.
So how do you decide who's a suitable candidate for a Medtronic spinal cord stimulator in particular?
Well, spinal cord stimulation is for patients with chronic pain. So first of all, you have to have chronic pain, which basically means that the pain has been there for more than 3 to 6 months. There are certain indications that we'll go over as far as what's appropriate for a spinal cord stimulator. But why do we choose Medtronic? Medtronic is an industry leader. They're the largest medical device company in the world. They also happen to have a fantastic stimulator. It's one of the smallest and slimmest batteries on the market, with amazing battery technology and a warranty to boot.
So let's go over some of the specific conditions or criteria that need to be met for a patient to even get a spinal cord stimulator.
Of course. So spinal cord stimulation, again, chronic pain. What type of pain are we talking about? We're talking mainly nerve pain, which is burning, tingling, shooting, those types of pain conditions. Who develops nerve pain? Well, people that have had back or neck surgery that have persistent pain tend to have this type of nerve pain. Additionally, there are various conditions called complex regional pain syndromes where people develop nerve pain either from prior surgery or frankly sometimes it just develops. And that is often a very debilitating type of nerve pain. And now, one of the approved indications for a Medtronic spinal cord stimulator through the FDA is diabetic peripheral neuropathy. And I think most people probably know what that is, but that is a chronic nerve pain that some patients with diabetes experience, which usually presents as a tingling, burning pain that starts in the feet and can also affect the hands, but usually the feet, and works its way up the legs.
Oh, well, I mean, we've been treating these patients for years and years, and I feel like the indications for using spinal cord stimulation just keep increasing. And so, we used to treat it mostly for those people that had back surgery, and they didn't get any better because they had that chronic leg pain as well. But now we have all these other indications, so there's so many more potential opportunities for people to get treated for their chronic pain because of this.
Indeed. Additionally, there's no pain medication with this therapy. So you're actually treating the pain without taking a pain pill. So you don't have the side effects that come with taking pain pills. You don't have to go to the doctor's office every month to get a refill on your pain medication. You don't have to deal with the pharmacy telling you they don't have the medication or they don't want to fill a particular type of medication. This therapy doesn't involve pain medication at all, and the patient has complete control over it too, which empowers them and provides them the pain relief that they want with the control.
No, for sure. Patients love that they have the full control over it. So let's go over some of the potential benefits as well as risks associated with using spinal cord stimulation.
Well, benefits are pretty obvious, right? You get pain relief. I think that's what most people that suffer with chronic pain are looking for. You're trying to get relief of your pain, and you're trying to do that without the side effects and the stigma that come with medications. So then let's focus on the potential risks. Why, would you consider not doing this therapy? Well, it is a surgical procedure to implant. I would say, however, it's a minor surgery. There's no cutting of any muscles. There's no cutting of any bones. So as far as surgery goes, this is not spine surgery. This is not removing tissue. This is simply implanting a device that then has a battery like a pacemaker that goes under the skin. This is minimally invasive. So as far as risks, it's really low as far as surgical risk. Now, there is always a risk when you're placing a needle in the epidural space of the spine. It's possible that you have a spinal headache. This is when fluid leaks from the spinal canal. That is easily treated. It's possible that you develop an infection. One of the reasons we choose Medtronic stimulators is because they have another aspect to their portfolio called the Tyrex envelope. This is an antibiotic-eluting envelope that you slide the battery into, and over the course of the next 1 to 2 weeks, you're getting antibiotics eluting out of that envelope, which reduces pocket infections by upwards of 60%. And that's really impressive, and that is unique to the Medtronic portfolio. Other risks are relatively minor. Obviously, if you're on a blood thinner, you're going to want to let your doctor know so that we can check with the doctor that prescribes that and modify that medication regimen so that you can get through surgery safely. The rest of the risks are really anesthesia risks. This is a type of surgery that does require some sedation, and the anesthesiologist is going to have to make sure that you're safe for anesthesia.
No, absolutely. And when we do a consultation for a spinal cord stimulator, we talk about all these things and we answer every specific question as it comes to us, because we want to make sure it's an enjoyable experience and that your pain is treated exactly for what you need. I know a lot of people ask me if it's a reversible procedure. I'll let you answer that.
Sure. Yeah, so spinal cord stimulation is fully reversible. There are 2 types of implant procedures that can be done. One is what we do, which is called a percutaneous electrode array. This is basically implanting electrodes that can go in through a needle. And so those can be removed very easily. The other is a paddle type of electrode array. This is put in by a spine surgeon, and it is done through removing some bone in the spine so that that paddle can be accommodated. That one is much more difficult to remove. It used to be about 50-50 as far as who gets a paddle and who gets a percutaneous electrode array. In our practice, as you know, it's about 99% of patients who get percutaneous electrodes because of how less invasive the surgery is and how reversible this procedure is.
No, absolutely. I know patients really do prefer the percutaneous leads, especially in the mid-back where the leads are put in when it's for the low back and leg pain, because it seems to be a less painful option. And easier recovery as well. That's always key. People want to get back to living their lives as fast as they possibly can. So let's talk about the programming and customization options that are available with Medtronic, with this system, and how can it adapt to an individual's needs?
Yeah, so there are an infinite number of programs available with the Medtronic stimulator system. The latest waveform, and we use the word waveform to sort of describe the way that the electrical impulses are being delivered to the body, that is called DTM, or differential target multiplexed. That's a very big jumble of words, but what does that mean? Differential target means we're targeting more than one area in the spine. Multiplexed means we're basically throwing multiple signals at the spine as well. Why is that important? That's mainly because we're trying to confuse the brain. So we're sending multiple signals that can actually relieve pain in a way that is safe and effective. And that particular waveform was studied in patients with back pain. Back pain is one of the main things we're trying to treat with this therapy. And it was a success rate of 84% at 1 year, which is very, very impressive for trying to treat back pain.
No, it's truly amazing, an amazing therapy that we now can offer our patients. Let's talk about the actual conditions and the pain disorders that are really effectively managed with Medtronic spinal cord stimulation. Let's go over the exact diagnoses that are now on label for this.
Sure. So the one that we've been doing for the longest time is called post-laminectomy syndrome. This is essentially someone who's had prior back surgery and still suffers from back and or leg pain. Second is complex regional pain syndrome, which we talked about briefly. That's a painful nerve condition, usually precipitated by a previous surgery or perhaps a fracture. So you broke your ankle, and all of a sudden you've got pain, inflammation, redness, swelling, all sorts of nerve-like symptoms that are confusing and very debilitating. And most recently, on-label approved indication, diabetic peripheral neuropathy, so painful neuropathy in patients with diabetes. And of course, as you know, we've used it off-label for many other indications. Patients with other types of neuropathy, maybe not diabetic neuropathy, but let's say you've got cancer and you had previous chemotherapy, you could have a neuropathy induced by that chemotherapy, and we're using this therapy off-label for that indication as well with great success.
Absolutely. I mean, we've had tremendous success in our practice with our patients, and people really love the device because they have full control over it for a chronic condition that they've been battling for years. So it is battery powered. Replacing the battery is a rather simple procedure. And let's talk about the actual procedure for replacing the battery and how long it actually lasts.
Of course. The battery from Medtronic, as I mentioned earlier, I really think this company has an unparalleled battery technology. In fact, they believe in that technology so strongly that they slap a 9-year warranty on that battery. Not just any 9-year warranty, but they're guaranteeing that that battery is not going to lose more than 5% of its charge capacity, which means as you recharge that battery and cycle from discharge to recharge, it's not going to lose more than 5% of the capacity of holding that charge. That's a really incredible claim. And they're saying that 95% of that battery capacity will remain out at 9 years, and it's warranted for that amount of time. When the time comes that the battery needs to be replaced, that's an outpatient procedure, can basically be done under a local anesthetic, maybe a light sedation, and it takes about 15 minutes to replace a battery. Usually, if the battery lasts you 9 or plus years, there's a new battery that has already been developed, and you're going to be upgraded to the newer technology every time a new battery comes out.
Absolutely. Maybe cell phone companies should be making Medtronic batteries.
Right. Agreed.
Medtronic needs to share their technology. Are there any restrictions or precautions that patients need to be aware of after receiving the Medtronic spinal cord stimulation device?
Yeah, there are definitely some restrictions. Immediately after surgery, we don't want you bending or twisting very aggressively. And the reason for that is basically you want the device to scar in place so that it doesn't move. And so those restrictions are in place for a period of about 3 months. Once everything is healed and you've followed those restrictions and the therapy's working for you, there are very few restrictions. You can go in the pool, you can go to the lake, you can submerge. There really aren't significant restrictions. You will want to let them know at the airport that you have a medical device like any other pacemaker or other device, and you'll go through that special line at security. Other than that, there really aren't a whole lot of restrictions with the Medtronic system. You are able to get an MRI, full body, no questions asked. Essentially just walk in, get your MRI in normal operating mode. You don't have to change anything. The MRI tech doesn't have to change anything, which is huge. Most of our patients, as you know, they require MRIs at some point in their lives. We're not just treating their back pain, we're also treating them for their shoulder problems, their knee problems, their hip problems, whatever it may be, and many of those problems require MRIs. And so with this Medtronic spinal cord stimulator, you're able to get those MRIs, no questions asked.
Absolutely. In our practice, I mean, our success rate is through the roof. What would you say our average success rate of spinal cord stimulation in terms of pain relief as well as improved quality of life is in our performance pain and sports medicine practice?
Yeah, I have to say it's at least as good as the published data of 84% success in back pain patients. Let's just look at diabetic neuropathy for a moment. In those studies, patients did exceedingly well, 86% success at 1 year. And I think we're seeing similar results. Now, with diabetic neuropathy, you do have to be aware that that is a progressive neurologic disease. Your diabetes isn't cured with a spinal cord stimulator. That disease, as it progresses, the neuropathy tends to progress as well. The results out at 5 years, about 55% success. Still very good success out at 5 years. Most of those patients still extremely happy. And those patients with diabetic neuropathy are 17 times more likely to get pain relief than conventional treatment alone. So if you have diabetic neuropathy and you're just getting medications from your primary care doctor, your podiatrist, or your endocrinologist, and that pain is still there, think about a spinal cord stimulator because you're 17 times more likely to get pain relief.
It's really incredible technology. We're so lucky to be pain doctors in these days where we have the technology to treat these conditions because, I mean, spinal cord stimulation has been around for almost 50 years, but the indications that it's now approved for, it's life-changing, to say the least. So thank you so much for being with us today, Dr. Wiederholz, and we'd like to thank Medtronic for sponsoring this episode. I'd also like to thank our two fantastic patients, Mr. Olson and Mrs. Bombersbach, for taking the time out of their day to share their stories. And a big shout out to Dr. Wiederholz for adding his expertise.
Thank you so much.
Remember, you can find us at Performance Pain and Sports Medicine in Houston and League City, Texas, to see if spinal cord stimulation is the right option for you. Remember, I'm Dr. Suzanne Manzi, and this is Pain Diaries. Take care of you so you can take care of business.